Why the concept of brain death is valid as a definition of death. The brain. The brain is the most important factor of the body. It acts as the neutral central driving force of existence. The brain is the receiving center of all sensory, cognitive, and emotional experiences. The body is directed by the brain. Brain death is death. Brain death is defined as the irreversible loss of all functions of the brain. Brain death does not imply death, is not a synonym for death, is not equal to death. It is the death of the individual. Neurologists believe that brain death has something essential that distinguishes from all other types of brain dysfunction, such as coma and vegetative state. The process of brain death. There are two processes that leads to brain death. The first one is the individual goes through brain edema. The swollen brain becomes compressed and blocks its own blood supply, which leads to the death of an individual. The second process, it begins with the death of the individual and involves the decomposition of the corpse and the dying of all cells. Loss of heart activity. When death is pronounced as a result of cardiac standstill, the diagnosis is less than in the circumstance of brain death. The traditional definition of natural loss of heart activity as death is not satisfactory because it is now possible to keep the heart beating by artificial means. Loss of breathing. If one proposes that the loss of spontaneous breathing defines death, then all brain death patients, by definition, dead. The decision to continue with ventilation can only be justified with the well-being of another person after the patient has been pronounced dead. Longevity. Technological advances help preserve the organs of a dead person. Machines are now able to reproduce some of the functions of the brainstem and hypothalamus to keep the body alive. The neurological community does not believe that this case disturbs the conceptual validity of brain death as being equivalent to death. The brain is dead and the functioning of the other organs is maintained directly and indirectly by artificial means and only for a limited time. The Church views on brain death. The criterion adopted in more recent times for ascertaining the fact of death, namely the complete and irreversible cessation of all brain activity, if rigorously applied, does not seem to conflict with the central element of a sound anthropology. Pope John Paul II. He affirmed that the Church does not see any fundamental conceptual problems with the idea of brain death. He sees death as a separation of the soul from the body. Pregnancies. Pregnancies have been carried to term in brain-dead mothers. It is possible for an individual who is brain-dead to give birth if maintained with a ventilator or other measures for a certain period. The mother's uterus and other organs are being supported as a technical vessel for pregnancy, in much the same way the heart or kidneys are kept perfused. Brain death is not irreversible. There is no recovery from brain death. Any other brain dysfunction that leads to recovery must be distinguished from brain death. Brain death can sometimes be confused with a coma or the vegetative state. Brain death is not a vegetative state, nor it is a coma. MRI suggests that if there are elements of consciousness present in these patients, it means that these states are not equated with brain death. Brain death does not require every single cell inside the cranium to be dead to be confirmed. Acceptance of death. It is difficult to accept the death of a brain-dead individual. Historically, death meant the loss of cardiac, respiratory functioning. People cannot accept that the body with a pumping heart and a pulse to be dead. The pulse and the heartbeat are maintained by the ventilators or medical technologies. Families of brain-dead patient often give reluctance to both abandoning the dead individual and to accept the removal of organs from their bodies for the purposes of transplantation. Education on brain death. One of the tasks of physicians and neuroscientists is to educate the public about discoveries in this field. Relatives of brain-dead individuals should be told that their relative has died rather than brain dead. They should also be told that the appearance of life is produced only by the support systems. This will ensure that the relatives will understand that the patient is dead and only looks alive by the use of ventilation.